95% of lumbar disc herniations happen at L4, L5, L5S1, and that's not the shocking fact. Spinal fusion surgeries for this area are successful less than 50% of the time, yet over 400,000 people a year choose this over safe conservative methods. In this video, I'll share with you our 3-step method to wind up reducing pain, eliminating inflammation, and getting you back to living a normal, healthy, active life without going anywhere near the operating room. We'll share with you how spinal decompression, specific adjustments, and state-of-the-art tissue rejuvenative therapy using SoftWaveTRT can get you results in days rather than years. Also, you want to stick around to the end where I'll show you my at-home test to see if you're a candidate for this. You won't want to miss it. Hey there, I'm Dr. Gregg Gerstin with Align Wellness Center, a corrective chiropractor in Northbrook, Illinois. Over the last 20 years, I've been helping people to overcome chronic pain, improve their posture, and get rid of stress-related health issues, even when they thought they couldn't and had tried everything. Here on this channel, we're going to look to provide actionable strategies for you to overcome and move better, feel better, and live better, all naturally without drugs or surgery. Go ahead and subscribe if you want to relieve pain fast, overcome and fix the root cause of your problem, and help regain your health. If you've had lower back pain that shoots down your leg and makes it hard to sit, stand, or sleep, there's a high chance that it's coming from your L4, L5, L5S1 disc. These two spinal levels account for more than 95% of all lumbar disc herniations. And the L4, L5, L5S1 discs sit right at the base of your spine. This is the area where the lumbar spine carries most of the load, absorbs most of the impact, and has the most mobility. When the L4, L5, L5S1 disc herniates, it could directly press on the nerves that go down your leg to your feet, and it can feel tingly or numb. It's not just discomfort. It's excruciating pain that makes everyday activities unbearable. Driving becomes a challenge, sleeping is disrupted, and simple things like bending to pick up your child or standing in line nearly feel impossible. If you've been suffering with an L4, L5, or L5S1 disc herniation and nothing seems to work, stay with me, because the worst thing you could do is wait. If untreated, herniations can get worse, and they could lead to nerve damage, loss of muscle control, and eventually result in surgery. And let's be honest, nobody wants rods or screws in their spine, especially when conservative, non-surgical solutions exist that can stop the pain, reverse the nerve damage, and restore your life. That's what's going to be covered next in this video. But before you consider back surgery, you need to know this 3-step model that alleviates disc pressure, reduces pain, and regenerates the discs, as well as restores mobility. We start with step 1, spinal decompression, where we take pressure off the disc so that it can finally begin to heal. If you've had a herniated disc at L4, L5, or L5S1, the first and most urgent thing your disc needs is space. The disc literally compresses, and that nerve crushes the nearby spinal nerves. This is what the burning, tingling, and numbness in your legs comes from. Decompression works to gently create a negative pressure on the disc, almost like a vacuum. This draws the bulge back inward and gives the nerve room it needs to stop firing pain signals. If you've ever felt like nothing could relieve that deep ache or pain in your leg, this part you can't miss. We use a system called the Universal Traction System, or UTS, with a special lumbothoracic seated decompression kit. The patient sits upright, strapped comfortably in, and supported the entire time. Unlike traditional tables that lie you flat, this method targets the disc vertically with control, comfort, and precision. Patients love it because they feel secure and safe. No sudden pulls or awkward positions, and you can walk out feeling better sometimes even that same day. Once we create space and reduce nerve pressure, it's time to realign the spine. Step 2 is where we help the disc function better with targeted spinal adjustments and disc pumping. You see, decompression created space, but if the spine is still stuck in the wrong position, the disc won't heal right. That's why local segmental misalignments at L4 and L5, correcting them, it's absolutely critical. When these vertebrae are out of alignment, they change the mechanics of your spine. The distortion increases wear and tear on the disc and can even cause more herniations. So if we don't fix the misalignment, the disc stays under stress, no matter how much decompression we do. That's where spinal segmental adjustments come in. It's not general back cracking, it's precise, targeted, and the key to long-lasting relief. We use both gentle manual adjustments as well as an impulse adjusting tool. That impulse adjusting instrument delivers controlled specific forces to realign the joint without twisting or turning or forceful movements. Patient find it gentle and comfortable. Then we apply gentle pumping action into the spine that gets the disc moving again. Why? Well, because discs don't have their own blood supply. They rely on motion to suck in nutrients and water and to get rid of waste. This process is called imbibition. And without it, your discs dry up and they dehydrate and break down. With it, they stay hydrated, repaired, and rejuvenated. Now that we've taken the pressure off the nerves and restored movement, there's one more step to spark true healing. This is where we bring in advanced tissue rejuvenative therapy to tap into your body's own healing and repair system. You won't believe how it works. You've created space with decompression and restored motion through alignment. Now comes the breakthrough that ignites actual disc regeneration. This is where SoftWaveTRT enters the picture. Even with decompression and pumping the discs need more than movement. They need healing. Herniated discs suffer from inflammation, lack of nutrients, and dead tissue. SoftWaveTRT delivers low-intensity acoustic waves deep into the affected area. These waves activate anti-inflammatory processes, recruit stem cells, and boost blood flow right into the damaged discs and surrounding tissues. If other treatments have only masked your system, this is the therapy that will actually target disc healing. SoftWaveTRT uses broad-focused acoustic shockwaves that penetrate deep without causing microtraumas. This increased circulation, which delivers fresh oxygen and nutrients into the disc and flushes away those inflammatory waste products. It also stimulates resident stem cells to migrate into the injured area and initiate tissue repair. At the same time, it breaks down excess scar tissue that limits motion and worsens degenerations. The patient also often feels significant relief after just a few sessions, improved mobility, and reduced radiating leg pain. For many, these benefits continue to grow over several weeks as the tissue regenerates, all without drugs, injections, or surgery. We've taken the pressure off the disc. We've restored alignment and mobility. Now we've planted the seeds for healing at the cellular level. Next up, I want to share with you my bonus that you won't want to miss. It's an easy at-home test to see if you could be a candidate for this entire system to start your journey to pain-free living. You may be wondering, could this 3-step disc rejuvenation system actually work for me? Well, here's something that I've pulled together that is a simple test that you can do at home to see if you have an L4, L5 disc bulge, or better yet, not really to see if you have an L4, L5 disc bulge, but to see if you may be a candidate for this disc rejuvenation system. If it is, we're going to guide for you to wind up connecting with a corrective chiropractor. If you need help finding one, you can comment down in the posts. Now, for this at-home test, what you're going to look to do is to find a chair that winds up having arms on it. You're going to need it to be really sturdy and firm so you can sit on it, especially if you're in acute pain in your lower back and having it go down your leg. What you're going to wind up doing is putting both of your hands onto the arms of the chair. And what you want to do is use your arms to start to lift your body off of the chair. Now, the more you can lift it off, the better and more accurate the test can wind up being to see that if we took pressure off of that lower back area, it winds up reducing the symptoms that you're having. So we're just looking to see if it can reduce some of the symptoms. It's not going to alleviate it. This isn't going to get rid of it. But if it can reduce some of those symptoms, or it feels better to wind up doing, or when you sit down it bothers you more, that says that you may be a candidate for this great 3-step disc rejuvenation system. And what I'd recommend for you to do is to find a corrective chiropractor to wind up helping you with that. If you're living with back pain and numbness and weakness in your legs from an L4, L5, L5S1 disc herniation, don't give up hope. Surgery is not your first or your only option. For many people, this 3-step disc rejuvenation process has been their answer they've been looking for. One that relieves pain, restores function, and gives them their life back. If you've learned something new and found this video valuable, please share it and like it. And if you have any questions about the 3-step rejuvenation system, drop them in the comments below. I love to hear from you. Also, subscribe now if you want to receive strategies that help relieve pain, fix the root problem, and get you back to regaining the health you wish you remember. I'll see you on the next video.